Do you frequently feel like your heart is racing, even when you're just sitting down? Or maybe you're sweating more than usual, even in cool weather. You might feel anxious or restless for no clear reason. These could be signs that your thyroid gland is working too hard. This condition is called hyperthyroidism. When it's caused by something called Graves' disease, your immune system mistakenly tells your thyroid to make too much thyroid hormone, like a car stuck with the gas pedal pressed down. Too much hormone speeds up your body's processes. It's not rare. Graves' disease is the most common cause of hyperthyroidism. Imagine your body as a smartphone. If the battery drains too fast and the screen flickers nonstop, something is overworking. That's what hyperthyroidism does to your body. What causes Graves' disease? Well, think of your immune system as your body's security guard. Usually, it protects you from viruses and bacteria. But sometimes, like a confused guard, it attacks your own body by mistake. In Graves' disease, the immune system makes a special protein called TSH receptor antibodies. These fake signals tell your thyroid gland to produce more thyroid hormone than you need, like someone keeps pressing the on button on your heater, even in summer. We don't know exactly why this happens, but genes play a role. If your mom or sister has it, you might be more likely to get it. Stress or smoking can also turn on these faulty immune reactions. So, while it's not contagious like a cold, it's a mix of your DNA and lifestyle that flips the switch. Have you noticed your clothes suddenly feeling looser without trying to lose weight? Or maybe you're feeling shaky when holding your phone or a coffee cup. These are common signs. People with Graves' hyperthyroidism often feel nervous, like they're always late for something. Your heart might race. You could feel it pounding in your chest when lying down. Some notice their eyes looking more wide or bulging, like they're surprised all the time. This is called exophthalmos. Others get a swelling in the front of the neck, goiter, like a small lump when you swallow. You may also feel too hot, sweat a lot, or have trouble sleeping. Imagine trying to run a marathon while sitting on the couch. That's how your body feels. Women might have lighter or irregular periods. Even your hair can get thinner. Each symptom is your body's way of saying, hey, something's moving too fast. How do doctors know it's Graves' disease? Let's say you go to the clinic feeling jittery and tired at the same time. The doctor will first check your neck, feel your pulse, and ask about your symptoms, like do your eyes feel dry or swollen. Then they'll order a blood test. This checks levels of thyroid hormones, T3 and T4 and TSH. If T3 and T4 are high and TSH is low, your thyroid is overactive. To confirm it's Graves', they may test for TSH receptor antibodies. Another test is a radioactive iodine uptake scan. Your body uses iodine to make thyroid hormone, so this test shows how much your thyroid is eating. In Graves', it's usually high and even across the gland. Treatment options: you've got three main paths. Medicines like methimazole acts like a brake on hormone production. Radioactive iodine quiets down the overactive cells. Or surgery, removing part or all of the thyroid. Treatments are personalized, like choosing between fixing your car engine, tuning it, or getting a new one, depending on your age, health, and preferences. Can you prevent Graves' disease? Since it's linked to genes, you can't fully prevent it, like you can't stop your eye color from being inherited. But you can reduce your risk and avoid flare-ups. First, don't smoke. Smoking increases your chance of developing Graves' and worsens eye symptoms. Think of smoking as adding fuel to a fire your body already risks starting. Managing stress matters too. Try simple habits like walking, mindfulness, or deep breathing. Like keeping your car engine cool in traffic. Eat balanced meals with enough selenium and zinc, found in Brazil nuts, eggs, and whole grains, which support healthy immune function. If you have a family history, get regular checkups and know your body. Early action can prevent complications. Prevention isn't about being perfect. It's about being aware and making small, smart choices every day. scientists are making exciting progress. Recent studies focus on better ways to predict and treat Graves' disease without harming the thyroid long-term. For example, researchers are working on biologic drugs, smart medicines that target only the faulty immune cells causing the problem, like turning off just one bad faucet instead of shutting down the whole water supply. One drug called teprotumumab was recently approved specifically for Graves' eye disease. It reduces eye bulging and pain in many patients. Another advance is using genetic testing to see who is at high risk before symptoms start. Imagine getting a heads-up like a weather alert for your health. Also, new blood tests can now detect the exact antibodies earlier and more accurately. Some clinics are even testing wearable devices that track heart rate and temperature continuously to catch early signs. The future is not just about treating illness, it is about staying ahead of it.